Thank you, Mr. Chairman, members of the board. For the next item, we have our Health Committee update. And so Dr. Tigan is going to come forward and provide that update for the board. And of course, we're happy to take any questions you may have related to the content of that presentation.
Good afternoon, Chairman Cooper, members of the board, and Dr. Cashwell. The Henrico County Public Schools Health Committee continues to meet weekly to discuss current conditions as well as next steps to maintain a healthy school community. I cannot begin to thank the members of this committee for their tireless dedication to this work, and I will highlight some of the work that committee has done over the last 3 weeks. Today's agenda includes the current transmission level for Henrico, the addition of an internal-facing contact tracing dashboard for our administrators and nurses, an update on surveying our staff about vaccination status, the distribution of proctored COVID-19 test kits, and the plans to begin screening those involved in winter sports. As I do at each meeting, I will start with the transmission level. On Tuesday, the Virginia Department of Health released the current health data for Henrico County. Due to the holidays, it was delayed a day. 3 weeks ago, the transmission level within Henrico was high. And as of this past Tuesday, Henrico remained at that high level of transmission. But the case count does continue to decline. Based on the 7-day data from October 3rd through 9th, the number of new cases per 100,000 was down to 156.9, and the percent of PCR tests that were positive was 5.0%. We also reviewed the level of school impact. As we begin to look at that level of school impact, last week, there were 90 cases of students or staff that tested positive and 3 outbreaks across our 72 schools and program centers. The overall student absenteeism level for the last week was 6.5%, but the actual attendance from school to school, of course, varies. This average is up 2.7% when we compare it to the absenteeism rate for this same time period in the 2018-19 school year, which, remember, was going to be our standard because that was our last regular full school year. Staff capacity does remain strained as additional resources approved are still being onboarded. Overall, the level of school impact is at medium, but when combined with the high transmission levels in Henrico, yields that Henrico overall is at a high transmission rate. So what changes have we made over the last 3 weeks to improve our processes and procedures as we continue to deal with the high level? Well, school health services, with input from the Richmond Henrico Health Districts, built an internal-facing contact tracing dashboard for our administrators and nurses. In addition to the creation of the dashboard, procedures and processes were reviewed and revised to better meet the needs of both our schools as well as our families. For example, schools now have letter templates that provide parents of students or staff as applicable with the date of exposure, which is often referred to as day 0, and the return date options and criteria, which you'll remember there's the option to test on day 5 or later to be able, with a negative test and no symptoms, to return on day 8, or continue to choose to quarantine until day 10, at which they would return on day 11. So they're provided with all of that information when they are first identified as either a positive case or a close contact. Should the parent or staff member not hear from a member of the Richmond Henrico Health District's contact tracing team, They will already have all the pertinent dates and may use the school-issued letter for school or work reentry. As an aside, I would like to encourage our families to respond to calls and texts from the Richmond-Henrico Health District. Their contact tracers are struggling to connect with our families to ensure the most accurate information is used to determine those isolation and quarantine timelines. The dashboard also provides scripts that may be used by school-based staff when speaking with parents or staff members. Another important resource to highlight is the process documents, which provide the school-based staff with a checklist of all the steps involved with working either a positive case or a close contact. There is even a what to expect document that schools can share with their parents. One means of facilitating contact tracing is actually knowing who is fully vaccinated. So moving forward, Henrico County Public Schools staff will be asked to share their vaccination status. This will help streamline that contact tracing process by allowing the verification of vaccination information ahead of any potential contact tracing. This new step, recommended by many of our staff members, would proactively gather the information and again, speed up the overall process. Staff will be asked to provide this information in Oracle. They would be asked whether they are fully vaccinated, yes or no, and able to upload a copy of their COVID-19 vaccination record card or proof from that VDH website. Please note that even with vaccination information, any staff member who is identified as a close contact or exposure to a positive case would be notified, and there would be verification that they are indeed asymptomatic. Equally as important as understanding vaccination status for contact tracing is the implementation of screening and testing. As we've shared in prior updates, we have been actively pursuing COVID-19 testing as a part of our mitigation plans with the goal of maintaining the health and safety of students and staff and the continuation of in-person learning. We have received 2,500 BinaxNOW COVID-19 AG card home test kits. Each school is receiving a supply of these kits to be kept in their clinic for the school nurse to send home with students and staff as appropriate. This particular brand of test relies on a trained virtual proctor to guide the user through the test via video call. It is a rapid antigen test using a nasal swab and a test the size of a credit card. The manufacturer claims that the results can be read in as little as 15 minutes and detects active COVID-19 infection. It is important to note that these test kits come sealed and they must be opened in the presence of the trained virtual proctor for the results to be validated. The proctors are currently able to support English and Spanish-speaking families and those who are deaf or hearing impaired. We have requested support in other key languages, and we are providing a how-to document in the 5 main languages spoken by our families and staff. And a complement to testing is COVID screening testing. 3 weeks ago, I shared information about the state's screening testing program known as the Virginia School Screening Testing for Assurance, or VISTA program. This program is in collaboration between the Virginia Department of Health and the Virginia Department of Education. And the goal of the VISTA program is to reduce the risk of COVID-19 transmission in schools through the early detection and identification of COVID-19 cases and prompt public health action to contain outbreaks. At the core of the VISTA program is vendor-conducted screening testing. Screening testing is routine testing of individuals who do not have COVID-19 symptoms or have not been known to be exposed to COVID-19. The division will be implementing VISTA screening testing of winter athletes and their coaches, both paid and volunteer. This will include both middle and high school levels. The students and coaching staff who are fully vaccinated may opt into the screening testing, and the rationale for focusing on winter sports is because they are being held indoors, and many of them are close contact. Principals will be sharing this information with their communities in their weekly communications, and coaches and activity directors will help athletes and families understand by sharing information at student interest and parent meetings. As always, the activity directors will work with families one-on-one to address concerns. Winter sports at the high school level begin on November 8th, and at the middle school level begin 1 week later on November 15th. The VDH feels confident a vendor will be in place and able to meet our needs beginning on those dates. One of our needs was also to complete screening immediately after school so as not to impact the instructional day. While beginning with winter athletics, we may expand to other extracurriculars and activities as time goes on. And at this time, I am happy to answer any questions you may have about any of the items.
Thank you so much, Ms.
You're welcome.
Dr. Tigan. I'm start with Ms. Shea.
Oh, all right. All right, just a couple of questions. Well, first a comment. I'm really excited about this dashboard for our staff. I think it's a game changer for our admin and our nurses and our front office staff that are processing not only the contact tracing, but the contacting parents. I know a lot have given me feedback that something like this would be very helpful. So I appreciate you all generating it. I also already having the return dates for our families in case they don't hear from the Department of Health is also a game changer in terms of getting our students back in school, which is important to all of us. A couple of questions. With the at-home test kits, you said they have arrived and that they will be shared with their schools. So what's our timeline there? I've actually gotten a handful of questions just in the last couple of days as families are struggling to access tests in the community.
The facilities department is getting them out to our schools over the next 2 days. And our plan was to make sure that they can be handed out to families starting Wednesday. There's meetings set up with nurses to provide additional training to make sure that they've actually seen a test kit being used and are able to answer questions for families, and provide support.
So we're looking at Wednesday, October 20th.
Yes, ma'am.
Okay, thank you.
That would be the latest.
That's very helpful. So we know looking at the trends of data in terms of transmission in the community, we're seeing cases go down. Are you seeing any specific trends within our schools in terms of cases or transmissions?
While there are fewer cases and fewer close contacts last week, I can share that both of those actually went down. But I do know too that we still are continuing to see outbreaks within, or clusters in classrooms in some of our buildings.
So I know previously and last year, most of our clusters appeared in transportation or athletics. Are we beginning to see some of those in our classrooms now?
Yes.
That is a bummer. But I appreciate you sharing that information with us. And then just my last question is, as we look at the screening of our students and coaches, can you share just, I'm sure you said it and I kind of missed processing it. Is this required for our athletes, and does vaccination status impact participation in it?
Everyone can be screened, even if they're fully vaccinated. Everyone will be screened unless someone who's fully vaccinated would like to opt out, and they certainly can. But we know that they might want to opt in, and so that's available to them even if they're fully vaccinated.
So if they're not vaccinated, then they would need to participate in the program. Okay. I think that's all for me. Thank you so much, Dr. Tigan.
You're welcome.
Thank you so much, Ms. Shea. Ms. Kinsella?
Yes, so referencing the 2,500 test kits, how will they be distributed amongst our 72 schools?
They actually come in sets of 6, so we have distributed them from at schools, and we've given them each like 3 packages so that they can have a number to start with, and then we have a remainder, kind of like a supply stash that is staying in our warehouse that then we'll be able to quickly get out. If a school is depleting their supply, they can say, hey, I need some more, and we can get them out there. We wanted to make sure they were coming from a central location and not trying to, because we have to monitor them, making sure that we're not having to move them from school to school. We'd rather move them from the warehouse to a school.
Okay, and will the test kits be given to students who leave the school with any of the symptoms listed on the COVID sheet?
They can be used for that, yes, ma'am, as well as if they're a close contact or if they are test positive.
Okay, because I'm hearing from constituents, and I've actually experienced this personally in my own house, where we left school or students are leaving school with a symptom on the sheet, and then the access to testing in the community in order to return to school is getting, access is limited, should I say. It's a real shortage of testing kits. So what do we recommend to families?
Well, I say they can get one of the kits through the clinic.
They can
They
right now.
can,
That's
yes,
really
that's
why-
one of the.
Yeah, it's absolutely the reason why we are so excited about being able to implement
But
this
they can
because
right
of the
now, like
access. Yeah, so
today.
that would be a case when the nurse would send the kid home. I mean, a parent could say, I don't want it, or
Right.
I have access to one elsewhere, but that's exactly the kind of
It's
use
already
case.
available. It's already available right now.
Well, that will be on
Starting next
Wednesday.
Wednesday.
Okay, so next week.
Correct,
Okay, so we
so-
just have a couple more days to get
Yes.
through.
But to your
And-
point, which is good, that is the kind of case we would be looking at. That's why we will have these in our schools. So if you're identified as a close contact and you're going to be quarantined, you would need to access a test on your own. We know that's been a hardship for families. Now we're able to provide that. And the same thing with a student who may exhibit a symptom and be sent
Right.
home, and they would have had to seek a test in the community. Now we can send them home with the test. So those are the exact use cases for these test kits.
And when and how will that be shared with families?
There'll be communication out from schools to their families. Most of them will be available through the clinic.
Okay.
And so if a child's going home sick, the expectation is that conversation is occurring between the nurse or the clinic assistant and the parent, as in, your child's sick, they have symptoms, and would you be interested in a COVID kit?
And I do want to be clear, this wouldn't be that anyone in the community or families would just come in and request a test to be
Right,
given
right.
to them. It's when we've identified you in our clinic as a close contact or having an illness, we then provide you with the test. So, and of course, that conversation would happen between the nurse and the family, along with the directions, as we mentioned, in a number of languages and some other tutorials of how to actually use the kit.
Having heard from some folks who were frustrated with the procedures, do procedures vary? I mean, I realize we have this great dashboard with access to links, but the procedures may vary from school to school, right? Like call your clinic or call your attendance secretary. And then some of our employees are not equipped to be handling this, and they need to be trained, right? That's important for me, for them, because they're frustrated. And then hearing from parents who are equally frustrated where the procedures aren't clear how to return to school.
Well, I think with the letters, because everyone is using the exact same letters, that will address any things that are not, synced from school to school, because the letter's a template that they print, and all they're doing is filling in the name and the dates. So that should be consistent. The schools are providing, I know that the kits are all going into the clinic, so that should be a common place of which they're interacting with the nurse. And again, the nurse is going to know that the child's going home sick to be able to offer that. So the hope is that these changes in processes and procedures are also not only going to align across schools, but and provide consistency. We do know that not all of our schools have the same resources, and there may be some differences.
Correct.
But that should be communicated by their school if there's something that they're doing that, and we can reiterate that if
I
we
would
need to.
appreciate some reiteration there, because as a parent, and I'll just speak from personal experience, as a parent, that form did not truly help me. It did not give me everything I needed to know to get my child back into school at the specific school.
You're talking about the illness letter.
The illness letter,
Okay.
yes. Just having a symptom, and of course, any child who goes to the clinic in our schools that has any symptom on the sheet, and quite frankly, if you even go to the clinic, it's my guess that you would get this sheet. So that process needs to be clear as well.
I think the personal with the test kits available and having solutions, that will alleviate some of that communication issue as well,
Okay.
because I think even whatever's on a piece of paper, when someone's telling me, here's a test kit, that would you like it, that you can take it home and use it.
Okay.
If it's negative, that your child can return to school as long as they've been fever-free for 24 hours. I think those things will help eliminate some of the confusion through the process, but we'll go back and
Okay, yeah,
re-examine
like
the
for a
letters.
specific school, maybe specific email address where you send a snapshot of your screenshot of your negative test, or a specific phone number to call. I just ask that it be reiterated. And then that's all I had. Thank you.
You're
And thank you
welcome.
for all the work the committee has done, especially on the new dashboard.
And that truly has been School Health Services and Christina Vitek. She has led that work with School Health Services and done an amazing job, all that whole team.
Thank you so much, Ms. Kinsella. Ms. Ogburn?
Thank you. And thank you, Dr. Tigan. That's just an incredible report that you gave. I mean, I look at the hard work that the committee is doing. It is far-reaching. It is important work. And I just don't think we can thank the group enough. And I tell you this a lot. I don't know how much sleep you've had lately, but probably not a lot. But I do have just two questions. And you talked about the staff being able to record or submit the vaccine status. Is that going to be required, or we're asking?
About staff, we're asking.
We're asking. And will we be able to have an update in the future about that status? As far as how many of our staff I know we'll give it a while before we would do that, but is that information going to be shared with the board?
We'd be happy to share that data with the board. We felt like, collecting it through Oracle, and I say this for your benefit, but also for our staff that might be listening, is that right now we're in open enrollment period for our health, and dental. And so as they go in to do that, they'll be able to access this information and be able to share that if they want, so that it makes it easier with contact tracing.
Absolutely. And I think that there's such value in that. And I know I've heard, as you said, a lot from our staff members about that. And the last question I had was on the test kits, which again is such a great service for our families. But I have gotten this questions from several parents that if a test kit was available, if the parent did not feel comfortable administering it, is there any scenario where one of the clinic nurses would be administering that COVID test, or is it strictly they take it home and administer it there?
It's strictly they take it home, but again, it comes with, when they scan the QR code on it, they set up an account, and a live human being on the other side of the computer or cell phone is going to walk them through every step. And so they aren't alone as they go through this, as far as taking the sample. If they're concerned whether they've taken it appropriately, that proctor will help them, reading the results of the test, and then they actually record the results and email it back to the parents as well as to the schools, to the school system.
And then I assume if the child has a negative test result, then they're allowed to come back to school as soon as they're asymptomatic, not feeling, because they obviously are taking that test because they've been sick in some way. But once they're feeling well, that negative test lets us know, and just as soon as they're feeling better, they can come back.
That's if they were out for an illness with a COVID-like symptom. But we're also using these test kits for a student who may have been deemed a close contact to a positive case. And so if they have this kit on day 5, they can actually take the test day 5, 6, 7, get the results, and then if they are COVID negative, be able to come back to school on day 8. And so they won't have to go to a doctor, or they can use the test kits for that as well.
Right, that sounds great. That's a great plan. I think that's a wonderful support for families. I have heard from a number of families, as the others have said, that it's very hard to even get an appointment right now. And so this is kind of breaking the dam, so to speak, of that testing and getting the kids back into school as quickly as possible. But thank you very much.
You're welcome.
Thank you, Ms. Upper. Mrs. Atkins?
Thank you, Dr. Tigan, for the presentation. I just want to confirm, I think it's 18 kits per school for each school. Is
I
that
believe
accurate?
that's what we have allocated for initial, and like I say, we have additional in the warehouse, and we've actually ordered additional test kits so that we would, stay up in front of the supply need.
Can you share who will be tracking the utilization of those testing kits?
Yes, there is actually a tracking form that we have been given, and we've actually expanded on that to be able to include who the test. They really want us to be able to just count how many tests went out to students or staff. We're actually going to track who they went to. That's at least the intent right now, so that we know, and can follow up if need be, that if we haven't heard from a student that took one home, do they need support? Is there something more that they need that we can do for them?
And it's important to understand the tracking of the COVID tests and have some data around the usage of them, especially knowing that providers are backlogged in things like immunizations, getting COVID tested, et cetera. So thank you for sharing that. Can you share a little bit more about where we are as far as tracking vaccinations on students and having a system in place to help with contact tracing for students?
On vaccinations as far as just COVID?
Right.
Sorry, I was going down the other vaccinations that are required. We don't have specific data on our students, although every Monday or Tuesday, whenever we meet as the health committee, which is traditionally every Monday at 11, we actually go over what the vaccination status is for the number of students that are in Henrico County. So not necessarily all our students, but that are between the ages of 12 and 15, and those that are, over 12 to 18, and those that are over 18. And so that data is available. It's available on the dashboard, and we do monitor that. I really would say that Henrico has done a really nice job. Our numbers are higher than a lot of other localities. And we're already, the health department has been working with us, and we stand ready for when the 5 to 11-year-old vaccine becomes approved. We'll be doing a clinic at Fairfield Middle, a clinic at Elko, both of those on our Saturday. They're reopening the Raceway to be able to do additional immunizations there, and families will be able to access that for the 5 to 11-year-olds.
That was a perfect response, because I'm hoping that families will hear sort of more of the collaborative effort that's discussed in the meetings, but also know that we're talking about the future as well for when the 11 and younger will be able to get inoculated as well. The other question that I have around mask breaks, I'm learning from students, that when they become uncomfortable, they will wait for a mask break, or they'll go ahead and pull their masks down so that they can breathe. Have you received any feedback from teachers or administration on the effectiveness of mask breaks?
I have not, but we can certainly check with the Division of School Leadership directors and see what feedback they have. And they can check with the principals at their principal meetings.
Thank you for that. And it also depends upon the type of masks that our children are wearing. There's a big difference between wearing an N95 all day and a cloth mask all day. And particularly, I think those that are, experiencing severity with asthma and symptoms like that. So I think it would be good to have a pulse check on the effectiveness of the mask breaks that we're having in our schools, just as a preventative measure. And then the other thought was, as we're approaching, our major holidays in this country, we're approaching winter break, fall festivals, Thanksgiving, New Year's, all of these wonderful holidays. Can you share a little bit, and this might be more for you, Dr. Cashwell, the marketing plan to share just reminders on being safe during these upcoming gatherings?
Absolutely, and I will say one of the outcomes I was most impressed with from the Health Committee last go-round was a video you all had put together going into our spring break that featured students and staff and nurses and principals and familiar faces and kind of some public service announcements, if you will, for our students and families, and those were broadcast through social media as well as through our schools, and I think we'll leverage a similar approach and certainly welcome any additional suggestions that come forward from the Health Committee, but we plan to lean into all of our communication methods to get those messages and reminders out there, to continue to be diligent. You're absolutely right. It matters.
I think we definitely have an opportunity to be proactive before we get closer to those times. And then I just want to share with the public, the Health Committee definitely spends the majority of time looking at impacts of COVID-19. But it's also critical that we look at other factors that impact health. And so prior to the Health Committee being created, we had SHAB, which is the School Health Advisory Board. And the division is wanting to reinstate the SHAB. And I'd love for Dr. Cashwell or Dr. Tigan to talk to families about how they can apply to be a part of the School Health Advisory Board. This board is significant. And it's important that we also keep a pulse check on some of the other things that are happening in the community that filters into our schools, impacts our children, impacts our staff. So if you could talk and share a little bit about how families could apply to be on the School Health Advisory Board.
Sure, and I'll reiterate and expand on your great introduction to the concept of SHAB, or our Student Health Advisory Board. Certainly the Health Committee, as it's been dubbed throughout the pandemic, has focused specifically on the prevention of the spread of COVID-19 and the impacts of COVID-19 on our schools as we found ourselves in a global pandemic and sort of that emergent circumstance. But we know that when we think of issues of student health, they're much more encompassing than simply the issues created during and by the pandemic. And so the important work that our SHAB had been doing, which again, this is an advisory committee to the board that has community members, representatives from our health department, other significant healthcare professionals in the community. And so we are seeking to get that group going again so that we can address a number of the broader, more global health issues. I know everyone on this board has been very centered around issues of social, emotional, mental health, all, trauma-informed care, all of those things that we've been able to touch on in other ways, but wanting to reinstitute that committee. So I know they've made a call for membership, and Dr. Tigan or Dr. Hughes, if you could share how individuals can go about finding the ability to apply for that experience.
Is it online? It is online. I was going to say, I thought there's a link online on the website that, if you go to the health it's through the health website, correct? That's correct. Just want to make sure. I haven't actually seen the link, so, but people can go on and they are seeking members right now. And they're looking for a diversity of people in different roles, and that goes for administrators, teachers, parents, community members. The more diverse that group is, the more impactful it likely will be.
Thank you very much, and that concludes all of my questions and comments.
Thank you, Ms. Atkins. A real quick follow-up for Ms. Shea.
Thank you, Reverend Cooper. Dr. Tigan, I've been continuing to digest some of your words from earlier, and it prompted another question for me. So when you were talking about the VISTA testing for our athletes starting November 8th, November 15th, you mentioned that they were confident they'd have an infrastructure set up by then. So as I process that, I'm making the conclusion that that the state running the program does not currently have an infrastructure set up to process things.
They do have an infrastructure, but what it is when a school division says that this is what we want to do, then they try to match up with a vendor and create, a meeting that the vendor can meet with the school division so that everyone's sure that they can meet our needs. And like one of our needs was, we've asked that they find a vendor that can provide us with people who can test after school, so that when our athletes get out of the school day, before they transition into the locker rooms or, to get ready, that we can do the testing at the school site. And so we know how many athletes we potentially have at each of our high schools and middle schools and what kind of manpower that might take. And they were confident they could meet our needs. But we haven't been assigned a vendor yet. So when we speak to our vendor, we just, that'll be determined. So I hate to promise something that we don't have a vendor MOU signed on that will.
So instead of saying that the infrastructure's not there, it would be more accurate to say that we're still awaiting being partnered with a vendor that can meet our needs.
Correct.
Yeah, and I think, for us, the messaging will be clear that those who are interested in participating in our winter athletic programs come into the athletic program understanding that the testing requirement. And so if for some reason on the first day of the athletic season, we didn't have all the logistics in place with our matched vendor, it would come shortly thereafter, and it would be an expectation.
And further clarity on that program, it is for screening asymptomatic individuals. Yes. So these email lists that we've gotten with frustration and as Ms. Kinsella was sharing of the difficulty of finding tests for students who are symptomatic or quarantined for whatever reason, that is not the intent of this program. And this program won't alleviate that. That's what the at-home test kits are for.
Right. And again, if they're sick, we hope they're at home and not coming to school to participate in athletics.
Thank you so much, Ms. Shea. Thank you all for all your questions. Answered a lot of mine. Quick question. When you took the health committee, my last question in regards to current sports, can you give me an update on the discussion that you all had as far as, proof of vaccination, if we're going to ask for persons to show,
John Carroll is actually meeting, he's had one meeting with ADs to just kind of talk to them about the what ifs, and I know he's meeting with them in the next few minutes here today to talk through that and provide them specific information about students and coaches. And, there's communication that will be going out that'll come through the ADs to the coaches and being able to share the communication through the parent meetings and through interest meetings, because kids are already connecting with coaches if they're interested. And so we know the sooner we can provide this information, the better. We've also are asking our principals to share on their weekly update information about this to their families, because, it might be a new 9th grader who's not played high school sports or a new 6th grader that hasn't been involved in school athletics. And so we want them to know that and want them to know it as early as possible.
Okay, because I was referencing, remember I raised this question in regards to, are we at a point where we're going to require proof of vaccination or negative test? And I was wondering if you have a chance.
Yeah, I was going to jump in because I want to make sure we got to the heart of your question if you saw me kind of pressing the mic. And I think the screening testing is required, and individuals can opt out of the screening testing if they have been vaccinated and provide proof of vaccination. So certainly we understand that individuals, athletes or coaches who have been vaccinated may may still want to participate in the weekly screening. And I mean, certainly we know vaccination is one way to avoid getting or spreading COVID-19, but it certainly we've seen breakthroughs. We understand that, our goal is to keep our athletic programs running, to keep everyone safe and obviously in school as well. And so the asymptomatic screening process we're talking about with VISTA is one way for us to do that.
Thank you so much, Dr.
You're
Tiger.
welcome.
Appreciate that. Thank you, Dr. Castro, for clarification on that as well. I have no questions. Thank you, Dr. Castro.